A couple decades ago, athletes who experienced traumatic injuries to the knees, hips, shoulders, and other joints often meant the end of a career. However, thanks to recent advances in medical science, athletes are not only recovering from those kinds of injuries, but getting back to competitive action within a matter of months. In this documentary, you'll meet 3 individuals who suffered major knee injuries and see how new procedures or rehabilitation methods have allowed them to get back in the game.
First offensive play for Minnesota, and naturally you hand it to Adrian Peterson across midfield. And Peterson on the first play from scrimmage will go the distance.
15, and Adrian Peterson is down, and he is writhing in pain right now.
An MRI confirmed he tore both his ACL and his MCL.
17 for 39. What a yes, and it counts over Joel Anthony.
Bypass the harder team in Miami.
Roche came down bad on his left foot. See him holding onto his knee and down.
Back to Lattimore. His first carry since the fumble. And Lattimore heading for the end zone. Touchdown, South Carolina.
Lattimore wrapped up by Lathers. Marcus Lattimore holding his right knee. It was his left knee that he injured last year about this time against Mississippi State.
Imagine being an athlete at the top of your game, only to suddenly come crashing down in a matter of seconds because of a horrific injury. For thousands of professional and amateur players in the United States, this problem is a reality. Junior Hannah Robinson and senior James Tintello are 2 young athletes who experienced traumatic knee injuries while playing basketball that threatened to end their sports careers.
I was playing a basketball game. It was one of our the games that we were playing, like one of the top teams in the league, so it was an important game. And I was at the top of the key, and I went to drive to the basket. And I just planted my foot in some weird way. I didn't even get to jump. And I just felt this really weird like pop in my knee. And I just like dropped to the floor screaming and crying. The whole gym was just silent. It was awful.
I was dribbling down. The guy that was guarding me had a bum ankle, so I knew I could get by him. Dribbled around him. One of the defenders stepped up, and so I did a jump step, came down from the jump step, my knee buckled, and I just heard it pop. And after that, it was kind of just shooting pain up and down my entire leg.
My coach like carried me like a baby off the court, and I didn't play for the rest of the game. That night, like my knee swelled up a lot. The next day, I used crutches to get around because it hurt a lot.
I went to urgent care, and the time that I had gone from the gym to urgent care, it had swollen up so much that the guy was like, "I'm not even going to try to x-ray it."
For Hannah and James, the news they received was not what they were hoping for. Both individuals had completely torn their anterior cruciate ligament, or ACL, one of 4 main ligaments responsible for stabilizing the knee joint.
I drove back down here a day early and went and saw him, and he's like, "Hey, you tore your ACL." And I looked at him, I'm like, "Really?" He goes, "You didn't just tear it, you like obliterated. Like it's like you really just tore this thing into shreds."
However, ACL and other ligament injuries are not the only cause of visits to the doctor by athletes every year. For some individuals, musculoskeletal abnormalities make competing in sports difficult. Senior Joe Crumlish was diagnosed with patellar femoral dysfunction, a problem in which the patella improperly tracks across the knee joint, causing pain and making it very easy to dislocate.
I dislocated my knee many times, about 30 times, and or more. And what it was I had a predisposition where my patellar tendon would track more to the lateral aspect of it, and it would pull it outwards, and it would dislocate my knee. That was just because I was born with it. It's how people's knees are all different. Their angles of joints are all different, and mine was a little bit wrong.
Currently, knee injuries account for 15% of all sports-related injuries to young adults in high school and college, according to the National Institute of Health. In a 2012 study performed by the Children's Hospital of Philadelphia, there has been a 400% increase in ACL injuries in teens and young adults over the last 5 years, an unfortunate increasing trend in the United States. In previous years, an ACL tear spelled the end of an athlete's career. The old procedure performed in the 1950s and 60s consisted of substituting a portion of the patellar tendon in place of the ruptured ACL. However, because doctors could not see the exact spot of the internal injury, the surgery only had a 40 to 50% success rate. Luckily for Hannah and James, new procedures were available. In the last decade, ACL reconstructive surgeries have experienced on average a 98% success rate thanks to advances in arthroscopic surgery, a procedure in which small incisions are made in the knee and microscopic camera and instruments are placed inside to aid the orthopedic surgeon in making needed repairs. In addition, new surgical procedures involve using a graft, a piece of transplanted tissue, from one of several parts of the body, such as the patellar tendon, quadriceps, hamstring, or from a cadaver that is attached to the femur and tibia and drilled into place. Before closing the wound, the orthopedic surgeon will verify there is ample tension in the graft and make sure the knee can fully bend. The surgery is usually completed within 2 hours, and the patient can generally walk out of the facility with the help of a leg brace the same day.
There's different grafts that you can get for your ACL repairs, and mine was the hamstring graft. So they took out a part of my hamstring and then screwed it into both my femur and tibia, basically just replaced ACL. And of course they, removed all the old ACL. They trimmed up the meniscus where that had torn a little bit.
And he kind of walked me through, the different types of ACL surgeries they have and how they come out with some new procedures for the knees and how they use, they can either use your patellar tendon or they can use cadaver, or they can, there's one of the ones that they can do. I ended up doing the cadaver, so some young male who had passed away and donated his organs, they took part of his hamstring muscle and they used that to basically reconstruct the ACL.
Joe's surgery took a different course. An orthopedic surgeon had to physically cut open and realign the muscles and tendons within his knee, as his abnormality was caused by genetics and not a faulty ligament.
For the surgery, I went in and cut a big scar. I got a big cut of my knee. I actually went in and cut my tibia out, moved it over a few centimeters, millimeters, and screwed it back in. That was called patellar realignment.
With all three enduring a successful surgery, they now turned their attention toward rehabilitating their injury. However, physical therapy would prove to be a great challenge.
Initially, you just have to wait for the swelling to go down before you can really do anything, because if it's swollen, it's not going to move much. You can't really even use your muscles if there's swelling in there. So the first step was ice. I slept with an ice machine on my knee and had my knee, propped up and stuff. So that was really the first big step.
And I spent the next 3 days in a chair in my house, and I didn't move, and it was awful. I had never been so sedentary in my life.
I couldn't walk on it for about 6 weeks. I had a nice big brace on my leg. I couldn't bend it or put any weight in it for 6 weeks.
As they would soon discover, building the strength back up in their weakened legs would be a difficult task, as muscle mass was lost from not being used, a process known as atrophy.
That slowed the rehab down a lot because you're losing a lot of muscle, and when you lose that much muscle, it's called atrophy, and your leg just shrinks basically. And they got to rebuild that muscle back to get to full strength or like functional strength as quickly as possible.
I remember when I first had that surgery done, and I was sitting in class one day in high school, and my friend looked over me and she was like, "Hannah, like your leg looks like it's on an anorexic person. Like it's so skinny. It had no muscle whatsoever."
I remember walking into the rehab center over here, and he goes, "Okay, do a quad set," which is just flexing your quad muscles. I said, "I am doing a quad set," and he goes, "You serious?" And I went, "Yeah." And he goes, "There's nothing there." Just
getting the strength back so that it was the same as what was in my left leg, like for a very, very long time. Like I'd say up until maybe like a year or two ago, like this leg was considerably smaller than my good leg.
I heard it in September. The surgery was in December, so there was a 4-month lag period where I didn't play sports, I didn't run, I didn't do anything. There was no exercise, so the muscle was already starting to atrophy.
Despite muscle weakness and unbearable pain at times, all three individuals had to push through the rehab if they wanted to one day return to competitive activity.
When you have your ACL reconstructed, there's like a protocol that your doctor will give your therapist, and like at week 4 they can do this, at week 6 they can do that. So I just followed, whatever the protocol was that my surgeon had given my physical therapist.
It was really discouraging the first month and a half because you don't you're just trying to get it to usable form. I mean, you can walk now, you can do this stuff, but you can't. You're an athlete. You want to keep playing. You want to go do sports.
I started with the bike, and the bike is used not only as, like strength or a little bit of cardio or something, but also to work on the movement, getting that range of flexibility back, because you do have to bend your knee to, get it all the way around the bike and stuff.
But the physical therapy exercises did not stop there.
The first thing I would do was get on this slanted board, and it was just kind of like a calf burner, I guess. I don't know. Because you kept your legs straight, so it was straightening out your leg.
Jumping was huge because, your ACL that's really prone to being torn, with landing on jumps. So a lot of my physical therapy was learning how to land properly.
They went from that, and then they gradually put me on the balancing ball, which is, just a platform with a ball underneath it, and you have to balance on it, and then you roll it.
It sucks. It's a lot. It's a good chunk of time. It's painful at some points because with the injury and the nerves in there, it can struggle.
The one thing that everybody hated, it was like notorious throughout the whole rehab center, was they put you in a chair, and then they'd have this thing that literally forced your leg to be 0 degrees with your knee.
After 5 months of physical therapy and rehab exercises, the students slowly returned to physical activity, but not without a protective brace to stabilize the knee joint. Unfortunately, they found it was more of a hindrance than a help.
They gave me a brace to wear, because obviously I was returning to sports where basketball, you're cutting all the time. So I remember my junior year, the first season back to sports of cross country, my knee had started to bother me, so I thought I would wear the brace that they had given me for the basketball games and stuff, and that was the worst brace ever. It slowed me down so much, so I will never wear that brace again.
I had a metal one that had metal on the sides of my knee that would help stabilize it, but I tore that thing to shreds just being active all the time.
I used to wear a brace, and then I realized I can deal without it. It's I've built the muscle up strong enough where it's not going to go out on me.
I'd still do it or wear it when I'm playing like basketball or soccer or something where I'm kind of, there's a risk of hurting myself here, but I refuse to wear it when I run.
With their physical therapy assignments over, the return to an active lifestyle has been met with little to no pain.
I graduated PT, they said you're good, you can start to really get into it. Obviously they have some things they don't want you to do until 9 months, and then some things that you can't do for a year, like the cutting, the flag football moves and stuff like that, and the basketball cutting. But I started running again, just straight line running, and starting to pick it up from there. And now I can sprint, now I can cut, I can do everything.
I can jump higher, especially after the rehab. But also I think moving, quick moving, back and forth, stopping and turning, that's a lot better.
And a lot of it's actually mental too, because after you do, that kind of injury, you're afraid. I was kind of afraid to go back out and test out, my new ACL. So
somebody asked me the other day, they're like, well, I mean, you tore your ACL, so what, if you had to give me a percentage of what your knee was, what would you say? And I was like, 92, 93%. I mean, I'm never going to be 100% again in my life, and I've realized that.
The first day I ran was in August, so between that process, it was just a lot of getting my knee to straighten out again and bend again, building the strength back up.
Although James and Joe have come a long way in their rehab process, they still experience lingering issues.
There's still some pain there just from the scarring underneath the kneecap, and just from moving it around, but no dislocations, no subluxations. That's pretty good.
I would feel it every time I ran, every time I took a step, and then eventually that just faded away.
Once in a while I'll just ache, but that's the majority of it. And I can just take an Aleve or a ibuprofen or something, or some medicine, and it'll help me.
For Hannah, the road to recovery was slightly longer, as she re-injured her ACL the following basketball season.
In my junior year of basketball, it was the 13th game, both my sophomore and junior years, I know, right? And that's when I hurt my knee again. I went down, and I just remember screaming, not again, I can't do this again, because it felt like the same as what it did the first time, and thankfully I wasn't torn completely. It was only like a 10% tear, so they just like shaved away the area that had torn off and left me with the rest. So.
New rehabilitation methods have also sped up the healing process for ligament tears and other musculoskeletal injuries. Recent protocols focus on restoring stability and range of motion within the knee while reducing swelling and pain through various exercises.
A lot of people saw an ACL 20 years ago as a career-ending injury, and now people are like, I can do this, I can come back from this, I can make this a small speed bump, but I can come back and I can be better.
They're developing new processes of rehabbing people. A few years ago, and actually about a decade or so ago, people had a knee replacement, they wouldn't walk for a little while, but now they want them getting to walking, moving gently, obviously, not too fast, and getting them bending faster. So they're actually advancing some of their care for certain injuries. Obviously, technology is advancing, new knee replacements, new hip replacements, shoulder is less, but they still have them.
Like if you were to look at my knee right now, you'd be like, okay, you had an ACL injury. Like, 10 years ago, 5 years ago, you'd have a cut up from the top of your shin up through the top of your knee.
Exercises are making different ones, combining this one with that one to make the whole effect better, to make them stronger, is good. Combining like weight loss with their exercise is also a good thing. Adding diet to things and that sort, all definitely help better an athlete, make them stronger and faster and better than they were before.
In addition, a relatively new method called neuromuscular electrical stimulation is used to send shock signals to the weakened quadricep and waken up the muscle so it can be ready for use again. Hannah, James, and Joe advise those with physical therapy assignments to listen to their therapist and commit to their exercises, no matter how easy or difficult they may seem.
If anything, I guess I just would have strengthened even more than what I did, just because it's always so important when you're rehabbing any kind of injuries to build that strength back. So.
I guess the only thing I do regret is that lag period where I didn't do my exercise. I mean, people tell you, I got some advice. One was, don't overdo it, so don't do more than they ask you to do, and the other thing is you can't underdo it. So you have to do exactly what they tell you to do, exactly when they tell you to do it.
This time I would definitely do the PT right the first time. It's important to follow what the PT says. They know their stuff. Exercises, they know the prescribed time and how to advance the care of the injury. If you don't follow the directions, it's going to put you back and make you not be able to get back to your sport as fast as you can.
In professional sports, it's no secret major knee injuries are on the rise. In the NFL alone, there were 58 documented cases of ACL tears in the 2013-2014 season, up from 48 ACL tears in the 2011-2012 season, and that number is only expected to grow. James believes the muscular imbalances from overtraining is a primary reason for this alarming trend.
It has to do with the evolution of the game of football, to be honest. I think half of it is the fact that these players don't realize that you can't strengthen the ACL, you can only strengthen the muscles around it. The other thing is with the helmet-to-helmet penalties nowadays, now players are targeting the legs. A player like Adrian Peterson's a once in a blue moon type of player that tears their ACL and comes back in 6 months and is better. So it's those stories of the people that work hard. But I mean, he had to have worked so hard to get that. That's the thing. Like they don't talk about them. Eventually, they're not going to have to cut you at all. They're just going to give you some healing process. I don't know how. It'll be interesting to see how players, because the way they're doing it, they're going to start streamlining it, and I think players are going to be able to get out from these injuries within 4 or 5 months back onto the field and going again.
For Hannah, experiencing a traumatic knee injury was a valuable life lesson as she learned to deal with adversity.
That was really the only hardship I've had to face in my life so far, knock on wood. But so I think it was just kind of like I can't do everything that I want to do without having to put something that getting set back and having to climb your way back up. So it definitely taught me how to deal with something setting you back and having to work back from that. So.
Going through rehab and strengthening his own knee gave Joe a new life direction. After seeing his own progress, he was inspired to help others achieve their therapy goals as well. Next fall, he will attend Nazareth College in Rochester, New York, where he will pursue his doctorate in physical therapy.
It's pretty cool to see a patient go from hardly being able to walk to being able to drive a car, function, and do those kind of daily activities that you couldn't do before. It's a growing field, and you're always going to have a job in that field. That's kind of why I'm going into it too. And it just you can see a lot of people getting better from just. I was an intern for about 2 months, and I saw people going from getting like weaker to much stronger.
All in all, James thinks if it wasn't for advances in sports medicine and rehab techniques, he would have been in much more pain.
Going forward, I think the pain that I had, I think that would have been definitely worsened 10 years ago. The rehab process would have been harder, again, just because of the pain. A lot of people can't handle that, and that's what stops them from continuing.